indeed a great pleasure to be with you, and we are fortunate enough that Dr. Miroslaw Ferenc, he is from Germany, and he's Director of Interventional Cardiology, Heart Centre Freiburg in Germany. He is one of the renowned cardiologists and founder member of European Bifurcation Society. When we look at the complex coronary disease, and then generally we see that where is the lesion from the beginning, from the branches, from the ostial or multiple. He is a specialist in those areas, means complex coronary diseases, complex coronary interventions. And we are very fortunate to share our experiences and his expertise in bifurcation lesions and see that patient in this area, in the Jammu and Kashmir, they are benefited by these kind of procedures. When we started this Department of Cardiology, it was used to do angiographies and angioplasties in camps, and doctor used to come here. Though we have grown up to full-fledged center, and we are almost the high-volume intervention procedures, and we do all kind of procedures. There's coronaries, there are pacemakers, they are peripherals, they are involving devices for heart failure. And it's a great day for us that Ferenc has chosen our center to be with us. He was in Bombay. He's going back to Delhi a day after. And we have done 4-5 cases since morning. We have shared 2 cases with him also. Till evening, we are going to do almost 10 to 15 cases. Let's see. And depending on the type of anatomy and lesions. So this is what it is. If you want me to speak in Hindi, we can speak in Hindi also.
Go ahead.
And बड़ा अच्छा दिन है मेरे लिए possibly.
Before COVID, I was, I think, one time in Srinagar for some workshops. So a wonderful area here in one of the best areas probably in Asia, and very similar to European Alps. I'm director of the cath lab at the University Heart Centre Freiburg, but Krozingen. And this is the largest center for interventional cardiology in Germany. So we do we do around 3,000 procedures, coronary procedures, and implant around 10,000 stents per year in our patients. And it means in majority of cases, our patients today have a very diffuse disease. There is no one stenosis, no one blockage. There are 2, 3. It's not only 5 millimeters stenosis blockage, it's a 50 millimeters blockage. And we just have done a case for a young lady with implantation of a very special, unique stent from Maryland, India. We could just cover very long blockage with one stent. And what what I always do and what I always recommend to my colleagues is if you implant the stent must be improved using some additional balloon dilatations to achieve perfect result. What I heard from you, so at the moment you don't have a machine for imaging, but you are on the way to have it. And in some cases we need insight from the view from inside the vessel, from inner part of the vessel, to see how the stents is working, how it looks, and do we have to perform some kind of correctures. And I think we do here today very good job, because all important staff is available here, and I think this is one very important sorry, this is one very important information to patients here in this region. They can be treated very elegant, very nicely. There is maybe some option to improve results in patients with extremely complex anatomy. And you will see, this is what we see in Europe, our patients are going to be older and older, and the blockage is more and more difficult to treat. And one of the options to treat such patients is also to use of different plaque debulking techniques. So there's a rotablator, orbital atherectomy, shockwave balloon, etc., on top. And I think this is also something what you should in next 1 to 3 years try to implement in this center, because then you will have very bright spectrum, to treat really definitely everybody. So we will go ahead today to treat, I think, 10 more patients I'm quite sure we will treat these patients perfect without complications. And you should know to avoid complications,